Good afternoon, everyone. I'm Sara Cornelison. This is my final project for NSC 892, Synthesizing Evidence-Based Project in Advanced Nursing Practice at Eastern Kentucky University. The name of my project proposal is Utilizing Physical Activity to Address Obesity in Adults. The PICO used to search literature was, in obese adults, how does increased physical activity compared to no physical activity affect weight? Obesity is defined as a BMI greater than 30. Obesity has become an epidemic across the nation and is a significant burden on the healthcare systems. According to the Office of Disease Prevention and Promotion, also known as Healthy People 2030, 2 in every 5 adults are considered obese. The prevalence of obesity increased by almost 13% in the years 2019 to 2020 in the United States. The economic burden of obesity is close to $6 billion a year. My proposed intervention is educating patients on the benefits of physical activity to improve weight and BMI. I hope to also improve the perception of exercise to that of a positive one to increase the amount of people participating. Clark conducted a systematic review and a meta-analysis of 66 studies that evaluated the effects of diet, endurance training, and resistance training on weight and BMI. Diet and endurance training were found to have a greater effect on BMI as P equals 0.005. Eaton et al. Conducted a random control trial that looked at a tailored lifestyle intervention in an enhanced group compared to a standard group. The lifestyle intervention was enhanced to include counseling for weight loss, encouragement of 10 minutes of exercise a day, and keeping food diaries. The enhanced group also received scheduled counselor meetings, monthly phone calls, and weekly mailings with information on diet and exercise. The standard group did not receive those. At the end of the 6 months, the percentage of weight loss was significant for the enhanced intervention group, with P less than 0.01. A qualitative study by Komatsu et al., conducted in Japan, was done to understand the perceptions of older adults who engaged in regular exercise in social groups. A community-wide exercise intervention was done. At the end of the study, there was improved joy for exercising, greater self-confidence, improved energy, decreased stress, and a perceived increase in support from peers. In all the studies done, however, there was inconsistent types of exercise interventions, and it was unclear if other variables such as diet may have improved the weight loss. Pender's health promotion model will be used to guide behavior changes. Pender's model is based on the goal to achieve well-being, not just the absence of a certain illness. Major concepts are based on previous experience, influential factors, behavior-specific cognitions, and effect and behavior outcomes. Applying the framework to the intervention is key. It will be imperative to educate the patients on the importance of physical activity as well as the positive outcomes. This directly affects the client's cognition and understanding of the importance for changing their behavior to include physical activity as part of their daily routine. This provides for structure and also allows for personal preferences to be present as well. Barriers also need to be removed for goals to be met. An example of a barrier includes the thought that physical activity must be done in a gym setting, when in reality, a lot of physical activity can be done at the home. Many people avoid physical activity because public gyms are intimidating and sometimes intrusive. If our clients understand that increasing physical activity can be done in the privacy of their home, they may be more willing to participate. It's also very important to plan enjoyable activities. Not everyone likes to run outside or use a stationary bike, for example. Providing options such as swimming, tennis, yoga, exercise groups with classes, and other means of physical activity that appeal to a variety of people would also result in increased participation. The implementation framework is a Johns Hopkins evidence-based nursing model. This provides guidance for implementation of the project by helping to problem-solve clinical decision using a 3-step process called PET, which stands for Practice Question, Evidence, and Translation. The nurse practitioner will be the project leader. Important stakeholders will be the office staff and other practitioners, patients and families, and insurance companies. Inclusion criteria for the project are willing adult participants who have a BMI greater than or equal to 30. Prior to beginning the project, the professional team will be assembled and will include medical assistants, practitioners, office manager and clerical staff, IT staff, and any other available dietitians or nutritionists. Once the team is established, the project leader, or the FMP, will educate the staff about the intervention of patient education and goal setting, as well as the steps of the project. The education will include the various types of physical activity opportunities that can be found within the community, as well as the various types of physical activity that they could use in reaching their goals. The education will be offered on 3 separate dates and times in an effort to accommodate to all staff. The project will begin in full by recruiting participants. Once they have been recruited, individual physical activity goals will be set. Bi-monthly weight and BMIs will be monitored for the first month, followed by monthly checks until the end of the project. The team will also meet bi-monthly to clarify that the process is going smoothly for everybody for that first month, and then monthly after that. At the end of the 6 months, data will be extracted from all of the patient's medical records on changes in weight and BMI. The final step is dissemination of these findings to each individual patient, as well as to staff for overall outcomes. A poster could also be made showing trends of weight loss or decreased BMI for the group participants. This could be displayed in their office for others to see the positive effects of physical activity as well. The outcome measures will be total weight loss in pounds, percentage of weight loss, total change in BMI, and percentage in change in BMI. Ideally, this project will provide normal practice guidelines for practitioners caring for these obese patients. There is evidence that physical activity in various forms can have a positive effect on BMI and weight. This project proposal can address the problem of adult obesity through using increasing physical activity and education by the FMP in the primary care setting. This concludes my presentation. Thank you.